We'll quickly be looking at the morphological features of chronic inflammation. I've always told you guys that anything that you see chronic, it means that it has been there over time. All right. Anywhere you see acute, it means that okay, that thing just started within a short period of time and it's kind of like going so up. Okay. But one thing is that acute things can be easily corrected. That's if you act fast. Okay. But chronic things, they kind of like cause much more damage because they have been there for a long time and they have weakened the immune system. Do you understand? So morphological features of what? Chronic inflammation. How will chronic inflammation look like? Okay, that's what we're trying to look like. Right? So chronic inflammation could occur at different areas of the body. Okay, so let's discuss how chronic inflammation will look like by starting from the definition. So chronic inflammation is also referred to as what? A slow or long-term inflammation, which is basically lasting several months to years. Okay, so generally, the extent and effect of chronic inflammation vary with the cause of injury and the ability of the body to repair and overcome damage. Okay, so anything injury or anything inflammation just solely depends on how strong your immune system is. Okay, so moving now to the morphology of how chronic inflammation will look like. Chronic inflammation is characterized by what? Infiltration with mononuclear cells. Okay, it's infiltration with mononuclear cells, which include macrophages, lymphocytes, and plasma cells, right? So at a region or at a place where you find chronic inflammation, you should find all these cells there, right? So there's tissue destruction, and this tissue destruction is induced by persistent offending agent. It has been there for a long time. It has been persistent. All right. So there's tissue destruction which is induced by persistent offending agent or by inflammatory cells. Okay. So now attempts at healing by connective tissues. Attempt at healing by connective tissue replacement of damaged tissue. So there's what? The body is trying to replace what? The connective tissues of any tissue that was damaged. Okay, so now this is accomplished by proliferation of small blood cells, that's angiogenesis and fibrosis. So if you are looking at the word chronic inflammation, you should most likely see small blood vessels trying to generate there, and fibrosis. Okay, and the biggest characteristics of chronic inflammation is what? Granulomatous inflammation. Granulomatous inflammation, I have a different video on that. It's basically like the body has inflamed and swollen up. Okay, so now that swelling up has a center. It has some neutrophils, lymphocytes surrounding it. Okay, and this one is basically what? To trap the microorganism that is causing the harm to the body. Okay, that's granulomatous inflammation. Have a lecture on that. All right, so this is what the morphologic features of chronic inflammation. See you guys in the next.